Childbirth is usually an exciting moment for a woman and her family. But in most rural communities in Liberia, giving birth can mean death. Sandra Colley learned that the hard way. A 20-year-old went into labor in the middle of the night in March. With no access to a vehicle, the family set out to walk Sandra more than an hour to the closest clinic.
And that night it was dark. It was 4, yeah. So that night we were going out, no way now, 4, no way. So that I feel I think it was coming down. I said, Mom, no way now, I can't make it now. So that the people spread the clothes on the ground. And leave me over here, I dare be cancer. Yeah, I like the child down there.
This was Sando's second pregnancy. The first had ended the same way. Sando's experience is common in rural areas across Liberia. Though Liberia has made some progress, it still has one of the world's highest rates of maternal mortality. 3 women died every day in childbirth, according to a survey by the United Nations agencies and the Ministry of Health. That's 1 in every 100 women. 8,500 babies under 5 also die each year. Debbie Kwashi has witnessed too many of these heartbreaking deaths in her role as officer in charge of the Attitude Clinic.
You feel discouraged, your effort and time go in vain. You monitor a patient, at the end of the day, they lost a child. It's painful.
4 pregnant women died here a year ago while on their way to the Attitude Clinic to give birth from Sando's own village.
There is no maternal waiting room as we speak. Patients come from way Blackaba, Bookliston, and Imping. Sometimes when they come, they do it on the highway before they reach to us.
Kwashi says the limited number of health facilities in the area is a big factor. Even the staff quarters have no electricity. During the rainy season, the roof leaks. Few professional nurses are willing to take up assignments under those conditions.
The facility really need attention. There are a lot of challenges. There are a lot of things that we need in that facility is not there. Looking at the condition of the building, there is no delivery set. There is no delivery set. The current system we're talking about, which you were asking me about, only solar we use. When the solar is down, there is no current. Looking at the leakage in the building, we are on staff, no dispenser. We only 2 professionals in the building. There are a lot of challenges in our clinic.
The Ministry of Health denies the numbers are as bad as the medical staff report in Norris's Town. Ministry of Health Head of Communications, Felicia Gbeso, said the Director of Family Health Division of the Ministry, Dr. Noah Gbapodolo Dennis, refused to comment directly on the issue. Gbeso said the ministry has numbers that are not as bad as those given by the Attitude Clinic. Gbeso did not respond to repeated text messages requesting the ministry's data. After a decade of 2 major health crises that ravaged Liberia's healthcare system, Ebola and COVID-19, experts are clear about what needs to be done to curb Liberia's maternal deaths. Edwina Sharif is the women's wing chair of the National Health Workers Union.
In our advocacy, that's one of our things that we advocate for. Now, all facilities should have maternal waiting room for the pregnant women. Because when our building is there, when the woman reaches her 9 months, she will come there and be there until she can give birth. And it's very important. But we have a big shortage in Liberia. Very, very big shortage in Liberia.
Rachel Strutter is a trained midwife. She has worked in the sector in rural Liberia for more than a decade.
We need more gynecologists, doctors in the rural area. We need more trained midwives and nurses in the rural area that will be paid well, that are willing to stay. We need ambulances. We need to see our roads are in good condition, that our patient can easily access the facility, they can easily get closer to the facility. Most often, if they are willing to, at all times they should be having right to health, like the same way everybody in Monrovia have right to health.
The Boakai administration lifted the budget for health from about US $75 million or 10% in the 2023 budget to US $80.5 million or 11%. That's a fraction of what is needed. Liberia's healthcare system is heavily reliant on donor funding. Currently, 924 doctors serve a population of 5.2 million, or one doctor for every 5,000 patients. This is far below the World Health Organization recommendation of one doctor for every 1,000 patients. Sharif blames corruption in the distribution of government and donor funds.
We observed that it was a late increase, but then how much is there for the rural area? Because the Abuja Accord said 15% of the budget should be allocated to health. So when the budget is made, they say, oh, maybe we'll give 50,000 or 50 million to health. How is it that spent there? We don't know. Where does it go? What do they use it for? And you go to the rural facility, there are no drugs.
Mark Serralo County District 17 Representative Bernard Blue Benson has demanded stronger legislative oversight of health funding.
We must also check the process to make sure that those allotments reach where they're supposed to reach. That is the issue. Remedying those situations to be sustainable, the government must intervene, looking at an area like Artington, where that medical facility is the only one there that takes care of Maysburg, Artington, and those surrounding towns. Should make that a priority.
For now, Sano and the other women here are waiting for improvement. They live in fear that their next pregnancy could end the same way as her last, in the death of her baby. But next time, the victim could be herself. This was a collaboration with New Narratives. Funding was provided by the U.S. Embassy in Liberia. I am C. Awe Meapo reporting.